This is the online pre-admission conference for the Integrated Nursing Program. Be sure to view the entire presentation. This is information for spring 2021 admission to first semester and PN to RN applicants. Notifications of acceptance will be emailed to the email listed by the applicant on their online application by December 1, 2020. No information will be given by phone. Accreditation. The Integrated Nursing Program at Madisonville Community College at the Health Sciences campus is located in Madisonville, Kentucky, is accredited by the Accreditation Commission for Education in Nursing, located at 3343 Peachtree Road, Northeast, Suite 850, Atlanta, Georgia 30326. Phone 404-975-5000. The most recent accreditation decision made by the ACEN Board of Commissioners for the Integrated Nursing Program found the program to be in compliance with all accreditation standards and criteria. The Commission affirmed the next on-site accreditation review for the fall 2022 cycle. View the public information disclosed by the ACEN regarding this program at http://accreditedprograms/programs/search.htm. Contact information: Dr. Marcia Whitfield, DNP, MBA, RN, Nurse Administrator, Division Chair. Email is marcia.whitfield@kctcs.edu. Phone number 270-824-1802. Or Lisa Moberly, Nursing Department Assistant, at lisa.moberly@kctcs.edu. Phone 270-824-1751. The Nursing Division is located at 750 North Laffoon Street, Madisonville, Kentucky 42431. Office hours are 8 a.m. to 4:30 p.m., closed from 12 noon to 1 o'clock for lunch, closed on Fridays in the months of June and July. Steps to apply. These are the steps to apply to the Integrated Nursing Program. View, read the entire online pre-admission conference presentation. Number 2, complete the online application form. The link to the online application will be sent by email within 2 weeks of viewing the online pre-admission conference and submitting your attendance verification. Please review the information carefully provided in the email. This must be completed by October 15, 2019 at 11:59 p.m. Number 3, complete the entrance exam. First semester will need to take the HESI A2 exam, and LPNs will need to take the NACE 1 exam. Number 4, obtain copies of unofficial transcripts and submit them with your online application. This includes your KCTCS transcript. Current KCTCS students may obtain unofficial transcripts by logging into self-service account. If you are not a current KCTCS student but have been in the past, please email paula.clayton@kctcs.edu to find out how to obtain the unofficial transcript. Number 5, submit certified copies of all transcripts from colleges outside of the KCTCS system to the registrar's office, only if you have not already submitted to a KCTCS school. Office of the Registrar is Madisonville Community College, 2000 College Drive, Madisonville, Kentucky 42431, or email paula.clayton@kctcs.edu. Number 6, complete the request for transcript evaluation online at the following link. The Integrated Nursing Advising Plan. There are 14 credit hours of prerequisite general education requirements and 0 to 3 credit hours of technical support courses. These courses must be completed with a grade of C or better prior to beginning the nursing program. Please note you may still be enrolled in these at the time you apply. Bio 137, Human Anatomy and Physiology 1, English 101, which is Writing 1, Psych 110, General Psychology, and NAA 100, Nursing Assistant Skills or Demonstration of Equivalency or Proof of Being on the Kentucky State Nurse Aid Registry. PN to RN applicants must also complete Bio 139, Human Anatomy and Physiology 2. Courses in General Education courses. There are 47 credit hours of Integrated Nursing Program courses and General Education courses for the RN track and 30 credit hours for the PN track. All courses must be completed with a grade of C or better. Integrated Nursing courses for first semester. Bio 139, Human Anatomy and Physiology 2, 4 credit hours. This course must be taken prior to or concurrently with first semester. PN to RN applicants must complete this before entering the program. NIP 116, Fundamentals of Nursing, 10 credit hours. Nursing courses for second semester are AHS 100, Human Growth and Development. Psych 223, or Developmental Psychology, may be substituted. This course must be taken prior to or concurrently with second semester. PN to RN applicants entering third semester must complete this before entering the program. NIP 126, Nursing Care Across the Lifespan. Optional Practical Nursing Exit course is NIP 140, Practical Nursing Role Transition. This course is offered in spring and summer semesters. It's optional for students who have successfully completed first and second semesters and wish to exit the program and license to become a practical nurse, or PN. Students who are not exiting the RN track may take this course in the summer and complete the RN program with their original cohort. Nursing courses for third semester include Quantitative Reasoning, or QR, any QR meeting the Associate in Arts or Associate in Science requirement. This course must be taken prior to or concurrently with third semester. And NIP 212, Advanced Medical Surgical Nursing. Integrated Nursing courses for fourth semester. Heritage Humanities, 3 credit hours. This course must be taken prior to or concurrently with fourth semester. NIP 216, Leadership and Transition to Practice, 9 credit hours. Admission Evaluation System. GPA will be configured on prerequisite and general education courses required for the nursing program only. A minimum GPA of 2.5 is required. Preference will be given to those students with a 3.0 GPA or higher. Readiness credit of 2 points will be given for each of the following. Completion of Quantitative Reasoning. Course must meet the AA or AS requirements with a C or better. Completion of an associate, bachelor, or master's degree. Completion of 12 or more credit hours in one semester with a GPA of 3.0 or higher. 3.0 GPA or higher with an additional 2 points if GPA is 3.5 or higher. Admission Evaluation System continued. Academic credit of 2 points will be given for a grade of A earned with 1 point for an earned grade of B in each of the following courses: Bio 137, Bio 139, English 101, Psych 110, NAA 100, Psych 223 or AHS 100, Quantitative Reasoning, and Heritage and Humanities. Overall points will be tallied by adding the following: A2 or NACE score, plus total readiness credit points, plus total academic credit points equal overall points. Entrance exam requirements: a score of 75 or higher on the HESI A2 if a first semester student. LPNs must score an 80 or higher to be considered for third semester entry. Any scores lower than 80 will place the applicant in consideration for second semester entry. Previous admission to a nursing program. The Integrated Nursing Program at Madisonville Community College, MCC, is willing to consider students for readmission from MCC or other nursing programs. Please contact the nursing office for readmission paperwork by emailing lisa.moberly@kctcs.edu. Students who have been unsuccessful or withdrawn from the MCC Integrated Nursing Program on only one occasion and has been more than 3 years since first enrollment are eligible to apply as a new applicant rather than as a readmit. Students who have applied for readmission once and been denied will not be eligible to reapply until 3 years have passed since first enrollment. A student who has attended a nursing program other than MCC within the last 3 years must follow the admission process for readmission students as follows: acknowledge reading, viewing pre-admission conference information, take the entrance exam, score a 75 or higher on the HESI A2 if a first semester student. LPNs must score an 80 or higher to be considered for third semester entry. Any scores lower than 80 will place the applicant in consideration for second semester entry. Submit transcripts, submit application, submit student readmission data sheet signed by your most recent nursing faculty instructor. This form is available in the nursing office. Submit to an interview if requested by the Nursing Admissions Committee. Technical standards or essential abilities. Nursing at the technical level involves the provision of direct care for individuals and is characterized by the application of verified knowledge in the skillful performance of nursing functions. Therefore, in order to be considered for admission or to be retained in the program after readmission, all applicants should possess sufficient visual acuity, such as is needed in preparation and administration of medications and for the observation necessary for patient assessment and nursing care. Number 2, sufficient auditory perception to receive verbal communication from patients and members of the health team and to assess health needs of people through the use of monitoring devices such as cardiac monitors, stethoscopes, IV infusion pumps, doptones, fire alarms, etc. Number 3, sufficient gross and fine motor coordination to respond promptly and to implement the skills, including the manipulation of equipment required in meeting health needs. Number 4, sufficient communication skills, speech, reading, writing, to interact with individuals and to communicate their needs promptly and effectively as necessary in the individual's interest. Number 5, sufficient intellectual and emotional functions to plan and implement care for the individuals. Student background policy and procedure. Purpose. Madisonville Community College's Nursing Division requires students to complete background checks and drug screening. It is the policy of MCC to review charges brought against students and to take such action deemed appropriate for the protection of fellow students, employees, patients, and families of patients of clinical facilities. Background checks on integrated nursing program students and nurse aid students are required for many reasons, including but not limited to: number 1, to enhance the safety and well-being of patients, residents, and in so doing to support the public's continuing trust in the nursing profession. Number 2, to ascertain the ability of students to eventually become licensed nurses or maintain current licensure. Number 3, to prevent potential liability issues which may affect the MCC Nursing Division and affiliated clinical facilities. And number 4, to comply with mandatory requirements of clinical agencies utilized by the Nursing Division. Excerpt from policy. All students must complete and submit a background check and drug screening through the approved vendor as a condition of continued enrollment as a nurse aid student or a NIP student. Failure to do so will result in mandatory withdrawal of the student from the NAA or nursing course. Continued enrollment in NAA or NIP courses is contingent upon a complete background check and drug screening. The student will be required to withdraw for failure to consent to a background check and drug screening, refusal to provide necessary information to conduct a background check, falsifying information, failure to provide any additional information wherein an investigation is warranted, failure to report a misdemeanor and or felony conviction occurring in Kentucky or any other state while enrolled in NAA or NIP courses, and failure to comply with the investigatory procedures when a cause for further action is warranted. If you need additional information about the expungement process, an expungement guidebook is available in the nursing office. Please note, prior to graduation, you will be required to complete federal and state background checks to apply for licensure. Former Employee Eligibility Policy from Baptist Health. It is the policy of the Baptist Health Madisonville to hire and train those individuals who have exhibited the values expressed by the organization. As such, former employees who are not eligible for rehire with Baptist Health Madisonville will be reviewed to determine eligibility to participate in a clinical or non-clinical education program at any Baptist Health Madisonville campus. Consideration will be given to employees who have left employment unfavorably for minor offenses such as tardiness, absences, etc. Employees who leave the organization under less than favorable situations who are currently enrolled in an educational training program will be assessed, and a determination will be made by the Human Resources Department to determine the eligibility of the student to continue within the facility for their current education or training program. Estimated program expenses. Tuition per semester. Resident is $179 per credit hour. Non-resident, contiguous county, $358 per credit hour. Out of state, $627 per credit hour. Mandatory BuildSmart fee, $8 per credit hour. Ebooks, $4,065 for the program. Uniforms, $52.50 per set plus shoes. Nursing skills pack per semester, $204 to $230. Course software, learning resources, $580. Background drug screening management, $146 per year. NCLEX review, licensure, and KBN fees, $850. Liability insurance per semester, $11. CANS membership, $35 per year. iPad any size, $299 and up, depending on type. How to schedule the HESI A2 or NACE entrance exam. Schedule online at www.registerblast.com/MCC or email casey.young@kctcs.edu or victoria.knight@kctcs.edu. Normal testing times, Monday through Friday, 8:30 a.m. or 12:30 p.m. Information needed: full name, test requesting HESI A2 or NACE, whether it's the first or second time testing, 2 to 3 date and time options, contact phone number, and email. Appointment options, scheduling details. Schedule appointment by September 23rd to take entrance exam by October 14th. Reschedules and cancellations are allowed, however, please keep to a minimum so all testers may test before the deadline. After 3 cancellations or reschedules, you may be put on a waiting list. Personal items. All personal items should be stored in vehicle or in lockers provided. Personal items include watches, bracelets, keys, wallets, purses, backpacks, cell phones, fitness trackers, etc. Items needed for testing check-in. Valid government-issued ID such as a driver's license. Exam fee, cash or check of $60 for A2 and $90 for NACE. KCTCS student ID, testing application, username and password if applicable. Allow 10 to 15 minutes for check-in and enter quietly since others may be testing when you arrive. HESI A2 exam content information. 6 sections of the test include anatomy and physiology, 30 questions, math, 55 questions, reading, 55 questions, vocabulary, 55 questions, personality profile, 15 questions, not graded, learning styles, 14 questions, not graded. Scores. Must score a minimum of 75 within last 4 years to be eligible to apply. Scores printed when test complete. Retake policy. May only take the HESI A2 twice every 3 years. The NACE exam content information. 200 total questions, 4-hour time limit. NCLEX style questions. Scores. Must be within 4 years. Must score a minimum of 80 for third semester entry consideration. A score of 79 and below is needed for second semester entry consideration. Retake policy. Must wait 6 months before retaking the NACE. May only take the NACE twice every 3 years. NACE information for LPNs only. Prior to making a NACE exam appointment, set up a National League for Nursing account here at this link, https:/4030/ext/NLN testing/. Create a new account or log in if you already have an account. Choose Madisonville Community College as your school. You must remember your login information on the day you test at the testing center. After the exam scores are available a minimum of 5 hours upon completion of the NACE exam. You must log into your account and click on the Reports tab to obtain scores and upload these with your application. Location of testing center. Madisonville Community College, John H. Gray Building, room 201. 200 College Drive, Madisonville, Kentucky, 42431. Application checklist. If not already completed, the following items need to be sent to the Office of the Registrar. Submit certified copies of all college, university transcripts outside of the KCTCS system if you have never submitted these to a KCTCS college before. Submit request for transcript evaluation if needed. The following items need to be scanned and saved. You will need to upload these items when you are ready to complete your online application. A2 test results, or NACE if applying as a PN to RN. An official college or university transcripts. This includes your KCTCS transcript. Complete the online application. We need your information. Now that you have reviewed the online pre-admission conference materials, please complete this brief survey. The online application will be emailed to you within 2 weeks. Use this link or QR code to access. https www.surveymonkey.com/r/NIP Spring 2021. Please note, the application is all online and supporting documents must be uploaded at the time you complete the application. Nothing needs to be turned in to the nursing office.